our topic is about sepsis. So let me ask you, what is the first thing that comes to your mind when I say sepsis? Or in other words, which one of the different body systems is affected when a patient is diagnosed with sepsis? Is it the pulmonary system, the cardiovascular, the urinary system, or the GI system? In fact, all of these body systems are affected. It's not only one system that is affected with sepsis. That's why sepsis is a very serious problem. So when we say hypertension, we know this is related to the cardiovascular system. COPD is the lungs, but sepsis, it affects them all. Now let's talk more about sepsis. At the end of this presentation, we will come out with 3 keywords. Those 3 words are keywords are very important, and they will give us a clue about the main points that we need to remember about sepsis, because it's not going to be about memorizing. We have to understand the mechanism, everything that goes on with the body if a patient is diagnosed with sepsis, and that's how we can know everything, like assessment, signs and symptoms, and treatment as well. So the first keyword we're talking about is SIRS. SIRS means Systemic Inflammatory Response Syndrome. Each word will give us a clue. Systemic means that it is involving all the body systems. It's not only, as we just said, it's not only one system. So this will keep it in mind, systemic. Inflammatory, it will lead us to the word inflammation. So what happens during inflammation? If we know that there's going to be inflammation in the whole body, we need to know what goes on with inflammation. Maybe this picture will give you a clue. So if we say that this area of the skin is inflamed, what can you say about it? What happens during inflammation? So when you touch this area, the temperature is going to be a little bit elevated. That's correct. It is red, it can be painful, and it might be swollen. Those are all right, signs and symptoms of inflammation. So if it's in the whole systems, it can show with fever, redness, and pain, as we just said. But let me stop a little bit at the word redness. Why do you think there is redness? This diagram can explain in details what happens during the inflammatory process. So all the blood capillaries will be dilated, the blood vessels will be dilated, and it will pull all the blood to this inflamed area, trying to help it. So when there is an area that is inflamed, it sends signals. I need help, I need help. So all the blood vessels will be dilated, pulling all the blood over there so that they can help this area. So can you imagine if this inflammatory process is taking place all over the body, in every body system? How is that going to affect the whole body? How is it going to affect the heart? Is there going to be enough blood going back to the heart for the heart to pump it back to the organs and give the required blood supply? Of course not. Let's see. This is a picture of the heart. It will show us in more details what is happening. So if there is no enough blood, because it's all going to treat that inflammatory process all over the body, is not going to be enough blood going back to the heart. This amount of blood going back to the heart to refill the heart before it pumps again is called the preload. The heart pumps this amount of blood out in the form of a cardiac output to supply the blood to all the systems and organs with enough blood. This amount of blood going to the organs to supply them is very important to provide them with perfusion. What is perfusion? Perfusion is supplying these organs with oxygen, because blood carries oxygen. So if there is decrease in preload, there will be decrease in the amount of blood going out, as well as decrease in perfusion. Perfusion is a very important word. Let's talk more about it. So another word for perfusion is MAP. MAP is what determines perfusion, and this is our second keyword. So our first keyword was SERS, and our second keyword is MAP. MAP is the mean arterial pressure, and it is the difference between the systolic blood pressure and the diastolic blood pressure. That's how we calculate it. We subtract and we get mean arterial blood pressure by calculating the difference between the systolic and diastolic. This difference is what determines the amount of perfusion, if it's going to be sufficient perfusion or inadequate to provide the needed supply. So now we got our two keywords. SIRS, which indicates it's a systemic inflammatory response. We know it involves the whole body and it's an inflammatory process. Our second keyword is MAP, which is the mean arterial pressure, which indicates perfusion. So let's talk about more practically about a clinical setting and how can we diagnose sepsis. How does a patient with sepsis, how is he going to look like? In order to help us figure out all the signs and symptoms that our patient with sepsis will have, we need to talk about compensatory mechanisms. When the organs through the whole body are not getting enough blood supply and they are not well perfused, they will start to do some compensatory mechanisms to overcome the shortage. So, for example, the heart will trying to pump enough blood the body needs, and he's not getting enough preload. So what is he going to do? He's going to think like, okay, let me pump faster so I can get enough blood. If I'm not getting enough preload, I want to get enough cardiac output, so let me pump faster. The lungs will think, okay, let me breathe faster, and so on. All the body systems will have their own compensatory mechanisms. They help for a while, but they don't help for long. They will take some time and they will all crash. And that's not what we need. So if we think about how to assess patients based on these compensatory mechanisms and on our keywords, the first keyword, as it is an inflammatory, the SIRS, it's an inflammatory process, will give us the fever as a sign. We can get fever. Our second keyword, MAP, will tell us that there will be a low blood pressure. There is not enough blood coming out, so there will be a low blood pressure. But we're more concerned about earlier signs than that. What do you think of an early sign that can give us a hint something is going wrong with this patient? We mentioned it earlier when we were talking about the compensatory mechanisms. Remember when we said the heart is not getting enough preload, so it's going to pump faster? That's what it is. Tachycardia or an increase in heart rate. That's our early sign. So you will notice that your patient is getting an elevated heart rate. It's not there before. It wasn't there before. It's a new sign. So it will let you think, what is going wrong? Something is going wrong, and you need to figure what it is. Because why am I stressing on that early sign? Because the best way to treat sepsis is to catch the early sign and treat it in the earlier stage before it progresses to a septic shock, and at that moment there will be irreversible changes that we cannot correct. So sepsis is all about catching it. Treating sepsis is all about catching it as early as we can. That's why we're very concerned about early signs. Okay, we got it. So we just said early signs are very important for prevention. So from all what we just said, what do you think can help this patient the most when we diagnose our patient with sepsis? What do you think will help them the most? There is decrease in preload, decrease in output, decreased perfusion. So we need to give our patient fluids. Fluids would be our third keyword here, and our last one. There are multiple kinds of fluids that we can give a patient with sepsis, but the main idea is that we have to give them fluids. We will have to figure out later the causes of sepsis, and we can administer antibiotics, a lot of other stuff, but fluids are going to be the first thing that we can do. This can save lives. Because, as we just said, the most important thing about sepsis is an early diagnosis and early intervention. That's why in a hospital setting, there is what's called a sepsis alert. And we have certain criteria where we check the patient's temperature, lactic acid, as we just said, heart rate, blood pressure, and all that. And we have certain guidelines that tells you, and septic bundle tells you in details, 1, 2, 3, exactly what to do after the first hour, within 3 hours, because we have to act very fast. So if you suspect sepsis, you will save a life, because it's all a matter of time. You have to intervene as fast as you can. Now, if we want to review our 3 keywords about sepsis that we have to keep in mind, the first one is SIRS. It's a systemic inflammatory response. This will help us know that it involves the whole body systems, and it's an inflammatory process, and we know what inflammation is now. The second keyword is MAP, mean arterial pressure, and it's all about perfusion. If those body organs and systems are not perfused, they are going to fail if we did not act quickly. And the most important thing is to give the patient fluids, and there are all kind of fluids that we can talk about in details later. Now we are going to practice some NCLEX questions that apply on the introductory part about sepsis before we can explain and go in more details about sepsis. Any questions? Just we can discuss them together.